Hi, my name is Hannah Jekyll, and I'm going to be discussing the article we read in class by Murray that discusses informed consent. So, to begin the presentation, I just wanted to posit a thought provoking question, and that is, what does it mean to receive informed consent? Many of us in the medical profession think that we know what informed consent is and what it means, but there's really a lot of fine details and parts to it that can lead to disastrous outcomes if we did not fully understand all the parts that go into informed consent. And it is important for us to know all the parts that make up informed consent before we go and mess up in the real world. So, what are the qualities of informed consent? Well, the definition literally is the process by which a patient learns about and understands the purpose, benefits, and potential risks of a medical or surgical intervention, including clinical trials, and then agrees to receive the treatment or participate in the trial. So, in layman's terms, this means that you have to explain thoroughly the procedure and disease processes and make sure that the patient understands exactly what you were saying before you can give care. Informed consent is not complete unless it has risks, benefits, and what happens if care is denied. So the article by Murray discussed some actual law cases where doctors did not mention any of these things. So one of them was Canterbury versus Spence. One of uh, the doctor's patients received a laminectomy and failed to mention that one of the risks of a laminectomy is paralysis. The patient rolled out of bed, fell, and then became paralyzed and sued the doctor because the doctor failed to mention that becoming paralyzed was a possible risk of the laminectomy, and the courts agreed. So that is why we have to include all possible risks, no matter how small or minuscule it may seem to our patients, so that they fully understand what they are getting into. We also have to include benefits and what happens when care is denied. So, a case that discusses these two things was Truman versus Thomas. So, in Truman versus Thomas, a patient denied pap smears because she thought that it was just an unnecessary and invasive procedure, and she did not fully understand why she had to get it done. And then she later learned that it was to detect precancerous cells within the cervix, and it can prevent uh, cervical cancer. She sued the doctor that failed to tell her about that, and the courts agreed that because she didn't know, that the doctor should have ensured that she knew what the risks and benefits of getting a pap smear were, and she won the case. Other risks that should be included before care would be long term damage, especially uh, in the case of people whose career depends on it. One of the examples listed in the article was if someone was like a pianist or a baseball player, they would probably need to know if they were going to have long term damage of nerves in their hand, because otherwise they wouldn't be able to perform their career. Other things that need to be included in informed consent would be anything that a rational person would want to know about a procedure uh, before it is done. So, in the article, one of the cases that discussed this was Nixdorf versus Hicken. And in Nixdorf versus Hicken, a needle was left in a patient during a surgery, and the doctor failed to mention that a needle was left within the patient until it was until she was sewed up, and it was actually several years until another doctor actually told her that a needle was left in her. So In order for informed consent to be fully attained there, she must have been told that things like that could happen or did happen. Now, while there are a lot of things to remember about informed consent, there are also some exceptions that we have to keep in mind. For example, informed consent is not necessary if a patient is not rational or old enough to make their own decisions. This also applies if the patient is unconscious. So, a 6-year-old is not going to be able to provide completely informed consent because they're just not rational enough to understand exactly what is going on. And during situations like that, the informed consent is deferred to the parent or legal guardian. Same with if someone is unconscious, they would find a next of kin before getting informed consent or waiting until the patient wakes up. It is also not necessary if the situation is life-threatening and there is not enough time to get consent. An example of this in real life would be if a patient just needed an emergency blood transfusion during surgery. Normally, before blood transfusions, informed consent has to be given because it is a very risky procedure. Allergic reactions can occur. However, if it is going to save the person's life, informed consent is not necessary, and the doctors will just give blood during the surgery. Risks are also not necessary to disclose if they only exist if the procedure is done incorrectly. So while I said earlier in the last slide that all risks need to be disclosed, that is only if the surgery is done 100% correctly. Only those risks are necessary to provide. If there are any risks to a surgery, but it's because the surgery was done incorrectly, the doctor or nurse or whatever medical provider doesn't need to list those risks. One thing that I also liked about this article was that there was a sort of checklist at the end of the article, because it kind of neatly summarizes everything that we need to remember. So, in order to get valid informed consent, we have to inform the patient thoroughly, ensure that understanding is obtained, and I'm in nursing school. So one way that we do this is we use the teach back method. So after we explain a procedure or medicine to a patient, we have the patient teach it back to us, explain it in their own terms and how they understand it. If we find that it is totally valid the way that they explain it and they completely understand it, then our teaching at first was effective, and then we can move on to step 3 and secure consent. Because even if the patient understands the risks and benefits of the procedure, we still need to ensure that consent is taken. Otherwise, that can be assault or battery. So, in conclusion, informed consent is when a medical professional explains a procedure with the risks, benefits, and what would happen if care is denied, and explain it in such a way that the patient understands what is going to occur, and we need to ensure that they know what is going to occur. Some exceptions exist to informed consent, including age and rationality. So, like I said earlier, a 6-year-old cannot give informed consent. You would have to defer to a parent or a legal guardian. And finally, consent and thorough acknowledgement of understanding must be obtained before care is given. So, using that teach back method, making sure that the patient understands everything that is being said to them is necessary in order for informed consent to be 100% valid. And that's all I have for you. All right, thank you.